So welcome to our webinar this afternoon. I am an employee of Pearson, which is the publisher of the Bayley-4. So that is a financial disclosure. We will be talking some about the Bayley today, as well as autism spectrum disorder more generally. We're going to start with a review about autism spectrum disorder, and then a little bit about the new features and changes that were made in the Bayley-4 for those who may not be as familiar with the Bayley. And then finally tying it all together to how you can use the Bayley-4 to help with evaluations of young children who may be referred or have autism spectrum disorder as a concern. Starting off, we'll look at early identification and autism spectrum disorder. So, of course, ASD is characterized by a few general areas of challenges or delays. First, persistent deficits in social communication and interaction. It could be current or by history. We often see deficits in social emotional reciprocity, ranging from abnormal social approach, failure of normal back and forth conversation, a reduced sharing of interest, emotions, or affect, failing to initiate or respond to social interactions. There's often also deficits in nonverbal communicative behaviors that we use for social interaction, like poorly integrated verbal and nonverbal communication, abnormalities in eye contact and body language, or deficits in understanding and use of gestures. Sometimes you might see a lack of facial expressions and nonverbal communication. There's also could be deficits in developing and maintaining relationships, such as how you adjust behavior to suit various social contexts, sharing in imaginative play and making friends, or an absence of the interest in peers. The second major area is the presence of restricted repetitive behaviors, interests, and activities. Here is where we look for at least 2 of 4 areas. The first is stereotyped or repetitive motor movements, use of objects, or repetitive speech. It could be lining up toys, as well as echolalia, hand flapping, rocking, spinning, those types of behaviors. Secondly, we see often an insistence on sameness or inflexibility to any changes in routines, sometimes ritualized patterns of verbal or nonverbal behaviors. So children get extremely distressed at very small changes. They have trouble with greeting rituals, wanting to do routines the same way every day, eating the same food every day, things like that. The third area is restricted fixated interest of an abnormal intensity or focus, like strong attachment or preoccupation with unusual objects. Those children that get obsessed with certain particular subjects, be it dinosaurs, trains, a certain TV show, and they get stuck on that thing or object. And lastly, we see hyper or hyporeactivity to sensory input or unusual interest in sensory aspects of the environment, like indifference to pain or temperature, a very adverse response to certain sounds or textures, excessive smelling or touching of objects, or a visual fascination with lights or movement. These impairments could have accompanying intellectual or language impairment. However, the impairments are not explained solely by intellectual disability or a global developmental delay. So there are some things that overlap. Sometimes in children with significant intellectual delay, you might see some repetitive motor movements and other characteristics that we have to differentiate with autism spectrum disorder. So according to the CDC, the incidence is 1 in 59 children and prevalence is 4 to 5 times greater in boys than girls. What we're talking about today is identification in early childhood. And early identification is very important in order that we have early intervention as well for the best possible outcome. The median age of diagnosis for autism spectrum disorder is 52 months, or 4 years, 4 months. However, research shows that 42% of children had received a developmental evaluation by the age of 3, but then were later identified with autism. So the question is, could we identify these children earlier? Perhaps monitor the children that are referred for those early developmental evaluations, or conduct some screening that is specific to autism spectrum disorder. So with their deficits in cognitive and linguistic development and the interdependence of those domains, these children are disadvantaged in their language, adaptive behavior, and possibly motor skill development. And this is the reason they often get referred for those early developmental evaluations. Experts suggest that we can reliably diagnose at 18 to 24 months by an experienced clinician. So perhaps we could identify a bit earlier than the 52 months and make sure that children are receiving appropriate intervention and support earlier in childhood. So the Bayley-4 offers 2 aspects that can help with these early evaluations. First of all, it's primarily a broadband detailed developmental evaluation across 5 areas of development. But within the scale, there's also a checklist of ASD-related behaviors. So we'll be looking at the contents of that checklist in this webinar. The more positive indicators observed during testing and verified by caregiver report, the greater possibility of ASD. Naturally, that would need to be validated by a more detailed autism-specific evaluation. In no way is our checklist able to diagnose or not. It's simply an indicator. But an item is considered positive if a score of 0 is obtained, meaning on these developmental indicators, if the child is not performing the skill yet, they get a score of 0, that is a positive on the checklist. And the more positive indicators, the greater suggestion that autism spectrum disorder would be a concern for further evaluation. As I mentioned, this checklist can not be used alone for diagnosis. You need to evaluate in a greater context with multiple informants and methods. Also, the younger the child, the less diagnostic certainty we have. And naturally, also always have to rule out other causes, especially in very young children. Are some of these delays we're seeing related to hearing, language skills, or motor skills? So we're going to shift to do a little bit of an overview of the Bayley Scales of Infant and Toddler Development, the 4th edition. Some of you may have used this, others may be unfamiliar. So the Bayley-4 is an individually administered assessment of developmental functioning for infants and young children, beginning at 16 days and going up to 42 months. You will get evaluation information across 5 developmental areas for cognitive, language, motor, social emotional skills, and adaptive behavior. The primary purposes of the Bayley-4 throughout its history is to identify young children who might have a developmental delay, also give information for intervention planning on skills that are in process or not yet obtained based on their age, and it's widely used across states for IDA Part C. So the structure of the Bayley, there are 3 scales that you administer by giving tasks and items directly to the child. That's the cognitive, language, and motor scales. Within language and motor, you also have two subtests that break it down into further areas. So for language, we have a receptive communication and an expressive communication subtest. You would get a score for how the child is doing in each of those areas, as well as a composite score for the overall language skills. Then for motor, you have your subtest for fine motor and gross motor skills and your motor composite score. The last two areas, the social, emotional, and adaptive behavior, are measured through a questionnaire given to the caregiver. You will get a score for social, emotional development, and then for adaptive behavior, these items are drawn out of the Vineland-3 adaptive behavior scales. So if you're familiar with that, you see similar domains and subdomains here, but essentially you get scores for the subdomains, receptive, expressive, and then the domain of communication, daily living skills, specifically personal development. And then for socialization, you get information on interpersonal relationships and play and leisure. So as we developed and revised the Bayley, we try to incorporate three major elements as we think about developmental delay. A lot of evaluation of very young children is sometimes done in a very informal observational method, which is great, and you can learn a lot from that. But from a scientific standpoint of wanting to get a metric or a score that's research-based, we want to administer some structured test items. We do that through direct observation of behaviors and milestones and active participation of the parent or caregiver in the evaluation process. So the Bayley is very different from a lot of assessments we have at Pearson for school-age children where the parent is not present. Here we want a caregiver in the room participating in the evaluation. And as we talk about some of the changes in the 4th edition, you'll see that we have even more parent input than in previous versions of the Bayley. Now, we have to keep in mind, as you're designing the test, that we want to give some structured test items. The more items you have, the greater reliability your scale is going to have. But you don't want too many because these are very young children with short attention spans, and we want to get the best measure we can of their skills. So there's a balance that our developers look at in terms of having enough items to get an accurate picture of development, but not making it too long to overly frustrate a very young child. And one of the reasons we include caregiver is because, you know, young children don't always display all their skills on cue or in the presence of a stranger where they might have some anxiety about being around a new person in a new environment. So we have lots of caregiver questions built into the Bayley where you can ask the caregiver for their input if you're not able to elicit it through direct observation. The other thing is that caregiver information helps us understand typical abilities across multiple settings. And then, of course, if you're used to testing young children, you know about the refusal rate, especially around age 2, 2.5, where they simply don't want to participate in the task that you're asking them to do. For some of those items, you're able to get caregiver input so that you can still give credit for something the child is able to do at home, but simply refusing to do in your testing environment. So one of the major enhancements we made to the 4th edition was, as I was speaking to, caregiver questions for some of the items. So we don't use a caregiver report alone in our developmental system because we are testing 3 areas directly and trying to elicit these skills. but it's helpful for reducing testing time and minimizing how many missing skills we might have. So there's 51 structured items that have a caregiver question associated with them. And some of them were particularly selected because of the characteristics of the items. Like we found there were certain items that had a high likelihood of refusal in the language and motor areas, and some of the language that was sometimes harder to elicit in the testing situation. Secondly, we introduced polynomous scoring. So previous versions of the Bayley had 0 or 1 scoring, where you got credit for the skill, or a 0 because you did not have that skill. And we realized that as we're looking at developmental skills, there's really often a partial development of something. A skill may be in progress, but not fully obtained. So in the Bayley-4, all the scoring for items was changed to 0, 1, or 2. And in that way, then we're able to give credit a 1 point for many items when it's not fully obtained, but that skill is in development. So I feel like it's given in a more accurate picture of young children's development. Also with the Bayley, it's challenging to keep the attention of young children, and you want to use the materials for all the items that use that at the same time. So you don't want to have to get out your blocks and your cups over and over. And for that reason, we tried to build in more support for flexible item administration. So we have related items, series items, and observation items. So many of the observation items are language skills, along with some from other areas, where you can just anytime during your evaluation, from when the child comes into the room until they leave, if you see something on that's an observational item, you're able to give credit or score that. Series items use the same manipulative material and are actually different levels of the same task. Like, for example, your puzzle board, you might have to put 4 pieces in correctly, and then you have to put 9 pieces in correctly, but you don't have to administer that more than once. So when you give a series item, you give it once, and then the child gets credit across more than one item, or the same score across more than one item. And then related items have different administration procedures, but use the same toy or manipulative material. So those are indicated on the record form so that you can try to do them all at the same time. So there's a lot of flexibility in terms of that you don't have to go, in fact, it's not a good idea to give items in numerical order down the record form. You want to do your series and related items together to facilitate your engagement of the child and efficient time management during the test. The last major change we made with the 4th edition was adding some digital administration option through our Q Global website. So for this, a device that's internet connected, could be a mobile device like a tablet, a laptop, or a computer, is used to replace your record form and your administration manual. And this digital administration even supports more the flexible item administration, because the program will help you find those series and related items and administer and score them at the same time. There are more in-depth webinars recorded on our website that go into more details on the Bayley-4 if you're unfamiliar with the test, but that's a little bit about it. Here we have a high-level look at the scores that you get. So you have scaled scores for your major areas, a standard score for cognitive, language, motor, social, emotional, and adaptive behavior. And then for the tests that had subtests like receptive expressive language or fine and gross motor, you get a scaled score for the subcomponents or subtest. And then many of those translate your standard scores into percentile ranks, confidence intervals, age equivalents, and so forth. Now, interpretation of Bayley results varies greatly across the U.S. and depending on state requirements, because there's no universal definition of developmental delay. Some places might require a 25% delay in functioning compared to peers or a 20% delay. Oftentimes, requirements look at standard deviations. Are you at least 1.5 or 2 standard deviations below the mean in a certain area? And then some places look at how many months below chronological age are you based on those age equivalents. The other thing we have in our manual to supplement your standard scores are some lists of indicators of developmental problems. There are lists of these for motor and movement abnormalities, like movement and muscle tone indicators, eye movement and coordination, and hand movements. There's a list of early indicators for attention executive function deficits. And then the list that we're focusing on today, the indicators for autism spectrum disorder. So these are red flags that can suggest underlying developmental problems. The incidence of these indicators is low, even in clinical populations, and so they're of note in your overall observation. So putting together a little bit about the Bayley-4 and autism spectrum disorder. We have a number of validity studies for the Bayley-4. So first looking at conditions that place a child at developmental risk, such as extremely preterm and very preterm infants. There's also data, research studies in our manual for clinical diagnoses, including autism spectrum disorder as one of those groups. Here we see the results of that particular study where we have our mean scores for the autism spectrum disorder group along with the matched control group, and all of them are significantly different on the p-values. So at the top, we have our sub-test scores that have a mean of 10, and you can see the control group is close to that, but our sample is scoring like average 3 to 5. Then we have our standard score for language and motor, also significantly lower than that matched control mean. That's closer to the average of 100. So this research supports that the Bayley is differentiating the development of those children that have been identified with autism spectrum disorder, because all of the scores were significantly different. Now, in terms of the checklist I alluded to, these are going to be our indicators of autism spectrum disorder. It's a list of items across the cognitive and communication scales. And an item is considered a positive sign on the checklist if the child gets a score of 0. So there's 25 Bayley-4 items that are considered potential indicators for autism spectrum disorder. Some of it is areas like imitation, social referencing, joint attention, as well as items that look at interactions with caregivers and with self. So we will look at those in more detail. Starting with the cognitive subtest, here we have a variety of items that look at how the child thinks, reacts, and learns about the world around him. So in our infants, it's items like, are they going to pay attention to familiar and unfamiliar objects? How do they play with different kinds of toys? For toddlers, we look at their exploration of new toys, solving problems and completing simple puzzles. Then preschool children, we look at pretend play, learning concepts, building with blocks, early understanding of colors, counting, and more complex puzzles. These items are arranged in developmental sequence, going from infancy to the preschool age children. So within the cognitive area, items look at sensory and attention to novelty in our infants, as well as habituation. Then object use and imitation, like banging objects, patting the table, putting blocks in a cup. Problem solving, searching and finding for hidden objects. Visual, motor, and perceptual abilities. These are some of our early puzzle items. Memory, with skills of remembering names, numbers, pictures. Play, classification, and concepts like color, size, patterns, and counting. So on the cognitive scale, here's our items that are on the checklist for autism spectrum disorder. First, item number 5 is recognizes the caregiver. And number 6 is reaction to caregiver. There are a few items, and these are examples that cross over between the cognitive scale and the receptive communication scale. So you would be able to score them the same on either area, cognitive or receptive communication. Sometimes people do use the Bayley scales as a standalone. Someone might just give the cognitive or might just give the language area or motor. And so for that reason, there may be an item that you see showing up in more than one place, so that if someone was only doing the language scales, they would still have that important item. Number 7, how do they react to the departure of the caregiver? 16, interacting with your own image in a mirror. 20 is an imitation item of pats the table. That was I think a new item in Bayley-4. 29, stirs with a spoon, squeezing an object. 57, a little bit later, but we have another imitation item with a 2-step action. And then item 59 looks at imaginary play. So again, these are where if the child gets a 0, we see that as a potential indicator. And the more zeros you have on these items, the greater concern you might be for looking further into autism spectrum disorder. So we're going to look at examples of a few items. So for item 20, here's what the directions look like in the manual. You always have information about what materials you need, and then what position the infant or young child should be in, whether it's supine or sitting or standing. Then you have your item instructions. So while the child's looking at you, pat both hands on the table 3 times and say, you do it. And then you can repeat that multiple times. And then we see with the score how you have the 0, 1, or 2 points. So 0, they're not doing the skill at all. 1 point, they pat one or both hands, but it's not direct imitation, and it's not, and 2 points is clearly imitating with one or both hands. So we have a video to illustrate this item.
Will you make some noises for me? You do it. You do it. Oh, good patting. Let's do it again. Ready? You do it. Yes, ma'am. You do it. You did a great job.
So obviously that baby did very well with her imitation skills. Number 29 is an item looking at stirring with a spoon. So it's again an imitation where you demonstrate the skill of stirring in the cup and then have the child to do it. And they can get partial credit for attempting to stir, hitting the cup with the spoon, and then 2 points for clearly making that stirring motion. So let me show you the video for this one.
Look at me. Now you do it. Are you trying to feed mom? See? Look at me. You do it. Oh, there you go. Yes, ma'am. Yes, ma'am. Nice job. She's trying. Nice job. She is trying. Look at her go. Are you going to get it? You're trying so hard. You're trying so hard. Yes, you are. Ready? Look at me. Now you do it. You do it.
That square is her security blanket.
Good job,
Grace.
Oh, even some imaginary play. Yeah, good job, baby. Okay.
So we have one baby that maybe we get a 1 point for attempting to stir. And then what's great is you're always observing and collecting additional information. So the second baby girl put the spoon in, but then we got some pretend as well of her, eating off of the spoon. For 57 is another imitation item. This time it's with a 2-step action. So it involves a small plastic duck and a spoon. You place the duck on the end of the spoon handle, and then you hit the bowl of the spoon and make the duck fly up in the air. And then you get credit, 2 points if you imitate both of those steps correctly and make the little duck fly up. I don't have a video of this one, but I can tell you young children absolutely love this item. It's really fun to make that little duck fly. So it's a popular one. So that's a look at some of the items on the checklist for the cognitive area. We're going to move to receptive communication subtest next and look at some of those items. So our receptive communication scale is looking at how children respond to gestures and sounds, how they recognize the words and directions that are presented. So for infants, it's a recognition of sounds, objects, and people in their environment. And then for toddlers, they identify pictures and objects, follow simple directions, perform social routines like waving bye-bye or playing peekaboo. And preschoolers have to follow more complex directions, identify action pictures, and show an understanding of basic grammar. So you can observe things like the reaction children have with what they're being presented a certain stimulus. Do they just flop down and tantrum when they're told no? And items get increasingly more difficult, and one way by the number of words, so how many objects you can name, or the type of words you have to recognize, like an action being more complex than an object, or prepositions and pronouns. Across the receptive communication area in the very young infants, the items are looking at attention or pre-verbal behaviors, then like calming and recognizing your caregiver, responding to your caregiver. Then vocabulary development skills, like can you identify objects, body parts, pictures, size, and color. For language structure, we look at understanding of pronouns, prepositions, and possessives. Social referencing, do they have social and play routines like patty cake or other games? And auditory comprehension, can you follow directions? So on our Autism Spectrum Disorder indicator list in the Bayley, we have number 2, calms when spoken to. Number 12, responding to their own name. 15, attends to play routines. And then the last 2 are understanding of pronouns. So because children diagnosed with ASD often do not consider another person's perspective, they're less likely to use appropriate pronouns. So the focus isn't whether you use a certain gender pronoun or not, but can you understand pronouns in general, or does a child get stuck on just one certain pronoun like me or my? So item 12, responding to name, is just observing their response when their own name is called. So you can have the caregiver stand by the child and call them by their name without touching them or using inflection. And then you have your control conditions, so to speak, of calling the child by an unfamiliar name, which you wouldn't expect the response to. And then you go back to calling them by their own name. So we look to see, do they orient, turn their head both times their name is called, but not respond to the unfamiliar name. And we have a video for this one.
Lila! Hi, baby. Hi. How's it going? Do you mind turning her back around to you? Okay. And let's see if she turns to me again when I do that. Lila! Hi, baby. You know your name. Look at you. You sure do. So, does she typically respond to her name when yes. Called by turning her? Yeah, most of the time, or just all the time? Okay, good deal. Does Sandra respond to you when you call her name by turning her head without you touching her? Almost every time, some of the time, or none of the time?
What was the one after almost every time?
Almost every time, some of the time, or none of the time?
Some of the time.
Okay. So she didn't really respond to you with the name calling this time, but yeah, she does it some of the time when, okay. All right.
Depends on how busy she is with focusing on whatever she's focused on.
Right.
This isn't item 12 is an example of where there's a caregiver question. So first, on the previous screen, we try to elicit the behavior. Then if we're not able to observe it, you have your follow-up caregiver question where you could say, does Mike respond to you when you call him by turning his head without you touching him? Almost every time, some of the time, or none of the time. And we score according to answer there. Item 15 is attends to a play routine. Here we ask the caregiver to engage the child in a familiar play routine for 30 seconds, such as patty cake, tickling, peekaboo, etc. We look at the elapsed time of the play routine and that the child maintains attention for at least 30 seconds to this social interaction. And here is a video for that.
Wanna play peekaboo? Peekaboo! There's Gracie! Peekaboo! Where's Gracie? Where's Gracie? There she is!
That was perfect.
Peekaboo! Oh, there she is!
Good job.
Oh, girl.
Okay, expressive communication is next. Here we're going to look at the other side of the communication skills of expressing with sounds, gestures, and then using early words and phrases and word combinations. So for children diagnosed with ASD, it's common to see some limited sounds, words, and phrases, or that they have some language, but it's used in novel ways. Also, there may be few social gestures, and the gestures are to meet the child's needs, such as tugging on a caregiver's hand and leading them to the refrigerator, versus a gesture pointing to a dog barking outside. They're more likely to take their caregiver to get them a snack. So our infant items here look at nonverbal expressions like smiling, jabbering, expressively, and laughing. For toddler items, you have to produce words by naming objects or pictures and answering questions. And then preschool age questions or items involve using words to answer more complex questions with simple sentences. So across the expressive communication area, the categories of the types of items we have are parallel to what we saw in receptive communication, with attention, vocabulary development, like words 2, 3, and 4 word sentences, and colors, understanding language structure like pronouns, possessive, action words, and ing endings, and then social referencing or initiating play. For the Autism Spectrum Disorder indicators, we have social smile as a very early infant item, then social vocalizing and laughing, soliciting attention, using gestures, jabbering expressively. Number 12 looks at joint attention. Do you direct attention of adult to an object? 13, imitating words, initiating play, combining gestures and words. And then we get into the pronouns again. Do they use pronouns, pose questions, and answer questions? So for number 2, the social smile is something that's an easily observational item that you can score incidentally throughout the assessment. Or if you don't see that, you can have the caregiver try to elicit the smile or laughing behavior with snuggling or changing their voice quality or singing to the child, things like that. Then item 2 can be scored with a caregiver question if you're not able to observe that behavior. So let's look at a video for this one.
Oh, I see your smile. I see it. It's so funny.
The baby?
book. Look at the book. Book.
Talking to you.
You're silly. Book. Book. Ball.
Where's the ball?
Yes, I see. Uh-huh.
Oh, that's the ball?
Block.
I want the ball.
Ball.
Ball. I have to sanitize it all.
So it's quite common on the Bayley that as you're trying to elicit a different behavior, you might be able to score another item and get that a great social interaction while giving another item on the assessment. Item 10 is the expressive jabbering, using vocal inflations to alter pitch or tone. And we look at the frequency of that in terms of scoring. And then there is a caregiver question if you don't observe it during testing. Item 12 is the joint attention. Do they direct the adult to see an object? So when they're playing or in the testing situation, you can see if the child directs their caregiver's attention to something, or you might put out a few objects within the child's reach and show it to them, and then see if they try to show you another object. And that has an accompanying caregiver question as well. Item 13 is imitating words, where you have the caregiver encourage the child to imitate words they know they're familiar with, but you might also note it through observation during the assessment. And you can ask the caregiver question. You see a lot of the expressive language items do have caregiver questions, so we can still score the skill based on their report. 14 is initiating play. So here we're looking at that game or social routine like we saw in receptive, but we want to see the child starting it. So smiling at the caregiver and then hiding, or initiating a game of peekaboo, or that famously fun infant game of dropping an object repeatedly and waiting for someone to pick it up. They love to do that from high chairs. That also has a caregiver question. 54 is posing questions. Does the child ask questions that start with our question words of who, what, when, where, why? And then it has to be grammatically correct. For answering questions, this is a later item, and they use the stimulus book to look at some pictures and answer questions. So you point to pictures and ask, what is he going to do? And look for the appropriate responses from the child. So here's an example of what the stimulus book looks like for that. There's 3 different trials. So the score is based on if they get 2 of those correct or just 1. So let's look at the video example here. going to pause there to get an idea of what that item is like. So that's the items you would want to be looking at on the direct administered scales. For our last two areas, we assessed through the caregiver questionnaire, the social emotional scale, which looks at mastery of emotional skills and the major developmental milestones that should be acquired by certain ages in terms of self-regulation and interest in the world, communicating needs, engaging with others, using emotions in a purposeful manner, using emotions to signal. So for ASD, we would look at, do they have poor self-regulation and inability to socially communicate, lack of emotional signals, or inability to establish relationships? And particularly, there is a sensory processing section on that questionnaire where you might be interested given the criteria around restricted repetitive behaviors. For the adaptive behavior scale, we get scores in communication, daily living skills, and socialization. And I noted here, I mentioned we have a number of recorded webinars on our website. There is one that is specifically about doing remote assessments of autism spectrum disorder using the Vineland-3. And these items come from the Vineland-3, so there's some overlap there. So you're doing evaluations for ASD, that might be a webinar you would be interested in. And then as you're testing, there may be other behaviors you observe that aren't items on the Bayley, but that you would see during testing. So does the child use the examiner's hands as a tool during testing, like putting it on an object versus asking for the object? Does the child have atypical vocalizations, high-pitched voice, growls, screeches? Do they produce unusual syllable strings? Do they have prosody issues like no inflection, speaking like a robot, unusual voice quality? And do they use echolalia, repetitive use of certain words or phrases? See that a lot, actually, repetitive use of phrases from Disney movies and things like that. Other things you might observe during testing are repetitive use of actual Bayley test materials like lining up blocks and pegs, licking, smelling, or scratching test objects, unusual or distressed responses like being excessively fearful, having a meltdown when one object is removed, or having a sudden change in affect. So these children have trouble with transitions. You may see that during the Bayley administration as you're trying to transition between different tasks, or do they stare blankly during testing? So those are behaviors you might see that would be consistent with ASD. At the same time, here's a list of a few things that would be inconsistent. So if they're actively seeking interaction, if they have a wide range of affect, they're making really good, sustained eye contact, if you observe frequent imitations, verbalizations and gestures, and they're happy to give back test materials and go to the next thing, or they initiate an interactive social game with you or the caregiver. So those would be things that are inconsistent with the profile for ASD during the Bayley. So this about wraps up our hour, but I want to say thank you very much for coming to our webinar today. And if there were any questions we weren't able to get back to, we will try to respond directly to you after our session ends today. And look forward to seeing you again next time.